Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Robert Brown and I'm 56 years old.
Okay, how may I address you?
Please call me Brown.
Okay, Mr. Brown. Today I'm going to discuss about your health issues. Is that okay with you?
Okay, doctor.
And during our discussion, I might take down some notes which will be strictly confidential. Is it all right?
Okay, doctor.
Okay. Now, Mr. Brown, can you? Can I address you as Mr. Robert or Mr. Brown? I just forgotten.
Call me Mr. Brown.
Okay, Mr. Brown, can you please tell me what have brought you here today?
Doctor, on the yesterday evening, suddenly I noticed that I have developed severe pain on my ankle. The pain was so severe that I took some ibuprofen tablets from the community, but that didn't help me much. The pain was so severe, and after that I came to the emergency, and after coming to the emergency they gave me some medication, and with that medication I felt well. They said that I need further evaluation, so they gave me here.
Okay, I'm very sorry to hear. I will try my level best to find out what's troubling you. You told that from yesterday evening you have been suffering from this pain. May I know that is this the first episode of such pain in your life, or have you ever experienced like this before?
It was this type of pain was present before, but not in the ankle. At the time the pain was on my great toe.
Great toe.
Yes.
Okay. And may I know that when did that occur? That pain?
About 11 months back.
10 months back. Okay. And in the meantime, you didn't have any such pain.
No.
Am I right?
Yes.
Okay. And you told, can you please tell me that did this pain come along all on a sudden or develop gradually?
All on a sudden.
All on a sudden. And can you please describe the pain for me? How was it?
This was so severe pain.
Very severe. I'm very sorry. And if I tell you that 0 is no pain at all and 10 is the highest pain that you can survive, then how would you grade it?
I will say it is 10 out of 10.
Oh, I'm very, very sorry. Then it's really, very severe pain. And has it spread to anywhere else, this pain, do you think?
No.
Or just in that ankle?
Just in the ankle.
Oh, just in that. Okay. And is there any specific time since that evening that you are feeling that it's worse or better?
No, doctor. It started suddenly, and the pain was so severe from the beginning.
Okay. Is there anything specific making it good or worse?
I took ibuprofen tablets that gave me somewhat relief, but not so good relief from the pain.
Not so good relief. I'm very sorry. And okay. And may I know that is there? Have you noticed any redness or warmth in those area in this
Yes,
ankle
doctor.
area? Yes. And may I just know that is this just one leg? Which leg is involved? Can you please
Right
tell
leg.
me? Right leg. Okay. And okay. And today, after getting up from in the morning, did you feel that there was any jamming present or not in
No.
in the ankle?
No.
Okay. Do you have any pain in your back previously?
No.
Okay. And any pain in your hand joint or hand?
No.
Okay. And okay. And may I ask you that well, how about your nail? Have you noticed any changes in your nail recently or something like that?
No.
Okay. And any okay. And now have you ever noticed any changes in your soles and palms?
No.
Okay. Now let me ask you some more questions. That do you have any headache?
No.
Any raised temperature?
No.
Okay. And any changes in your vision, like loss of vision or blurring or redness?
Yes, doctor.
Can you please tell me a bit more about it?
Doctor, I have diabetes for a quite long time, and truly speaking, I was not so much concerned with my health, so I didn't take this medication, and for that, I had some problem in my eyes. I developed blurring of vision, and doctor said that there are some new blood channel in my right eye, and they
Okay.
gave me some therapy called phototherapy.
Okay. When did this treatment take place?
1 year back.
And since then, how have you been going on with your eyes, with your
I think
eyesight?
I am fine. That is, it hasn't improved so much, but it is not deteriorating much.
Okay, okay, okay. And do you have any rashes in your face or anywhere else?
No,
Okay, any soreness in your mouth or anywhere else in the body?
no.
Okay, any joint pain?
I had
Any
osteoarthritis
other joint pain?
before.
Then
I
any
had
other joint pain
osteoarthritis,
like
doctor. I had
okay,
osteoarthritis before on my knees, and for that I took paracetamol and codeine tablet. And when I feel that pain, I only took those.
only when you feel the pain.
Yes,
Okay. And for how long have you been diagnosed as this osteoarthritis?
last 3 years.
Okay. And how are you going on with this pain nowadays? How is the control?
The control is good with the physiotherapy and with the medication. I think I am fine.
Quite good. Okay. And do you have any difficulties in your swallowing or speech?
No,
Any weakness in any parts of the body?
no.
Any abnormal sensation anywhere?
Yes, I can feel lace on my legs.
Okay. For how long?
It is around 5 years.
Okay. And okay. And you tell you feel less around legs. Have you ever sought any medical attention for that?
I visit my foot doctor regularly.
Okay. And how? What had they to give an opinion about? What did they tell you? Can you
They
please
said there are
remember?
some problem with the nerve.
Okay. Okay. And I guess then you have been on some medication for that also. Am I right?
Yes, doctor.
And do you take those medication regularly? Can you please
Yes,
name it?
doctor.
The medication.
Yes,
Okay.
doctor. I
Can you
take
please name the medication?
pregabalin.
Pregabalin. Do you take it regularly?
Yes.
Okay. And nowadays, do you think that you are feeling a bit good in your legs, or has it been the same?
There was pain before, there was burning sensation, but that is not present now, right now.
Oh, that's all right. And okay. And do you have any chest pain?
No,
Any racing and pacing of your heart?
no,
Any shortness of your breath?
no,
Any chest tightness or nausy chest?
no,
Any cough?
no,
Any raised temperature?
no, doctor. I told you before.
Okay. Sorry. I'm very sorry. Any changes in your weight?
I gained a weight about 5 kg over the last 6 months.
Okay. May I know that whether it's intentional or unintentional?
Unintentional.
Okay. And any weather preferences?
No,
Okay. And any lumps and bumps anywhere in the body?
no,
Any okay, any lump and any sorry, any night sweats?
no.
What about the water work? Has it been all right?
Yes, doctor.
Any frothiness?
That was present before.
Okay, and you told that you have diabetes. So sometimes diabetic patients can develop some kidney problems. Are you aware of this?
Yes, doctor. I have kidney problem also.
So are you under regular follow-up for this
Yes,
problem?
doctor.
And do you know about your recent records, kidney records? How is it?
They said there are some raised kidney points. I don't know exactly.
Some raised kidney points. Okay. And are you on any medication for that?
I am taking pressure control medication, Remipri, and they said that it will cover that kidney.
It will cover that. Okay. Okay. And when did you last measure your kidney markers?
3 months
Can you
back.
remember? Okay. And that's all right. And how about your bowel movement?
Fine.
Okay. Any blood anytime in the back passage?
No,
Okay. And may I know that apart from having this diabetes, some kidney problems in due to diabetes and some osteoarthritis. Do you have any other known disease condition?
Yes, doctor. I have high blood pressure.
Oh, you have high blood pressure. I'm very sorry to hear. May I know what medication do you take for it?
Remipryl.
The same blood pressure. Okay. And has it been under control, your blood pressure?
Yes, doctor.
Okay. And your diabetes, you told that somewhat you were not so much, not so much following the medication. But now, do you take this medication regularly for
Yes,
diabetes? Okay. And how is your control of the diabetes?
it is good now.
It is good, very good. And do you know anything about your blood cholesterol level?
No,
Okay, that's all right. And any other disease condition that you would like to mention?
no.
Okay. And you told that you take paracetamol, I guess, for your
Yes, doctor.
yes, for your pain and ramipril. And may I know that do you take any other medication?
Yes, doctor. For my diabetes, I take metformin, linagliptin, and insulin. And for my high
Okay.
blood pressure, I take Remipryl. They also gave some cholesterol lowering drug. I forgot the name.
Okay, that's all right. And have you noticed any recent changes in the dose of any of the medication?
No,
Okay. Well, 3 months back, you went to check your kidney doctor. Did at that time the doctor change in the dose of ramipril?
no,
Okay, that's all right. And any allergy to any medication?
no,
Any over-the-counter medication?
no,
Okay. Any medication through your blood channels?
no,
Okay. Any transfusion?
no.
Okay. And may I ask that do you have anybody in the family with similar type of condition?
My father had also diabetes and mother had high blood pressure.
Okay. Okay. I'm very sorry to hear. And may I know that may I ask you some personal questions at this moment?
Okay.
Do you smoke?
Yes, doctor.
How many sticks for how long?
About 5 sticks per day for last 30 years.
Okay. And okay. And I think smoking is very bad and it can add to your condition as well. So I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Will it be all right?
Okay, doctor. 2 minutes remaining.
Okay. And do you drink alcohol?
No,
Okay. Do you take any other party drugs?
no,
Okay. Have you been to any travel to recently to any other country?
no.
Okay. May I just ask how about your food habit? Do you eat seafood or something like that?
Yes, doctor. That is my problem. Doctor said to control my diet. A bit they gave me a diet chart, but I cannot follow that. I usually like to eat beef.
Okay. Okay. Yeah, I can get it. I will get to it later on. And do you drive? May I know?
No.
Okay. May I ask you some more personal questions at this moment? Will it be okay?
Okay, doctor.
May I know whom do you live with?
My wife and children.
Okay. That's all right. And may I at this point know that what is the concern?
Why I have developed this pain, doctor? Is it
Actually,
something
at this
serious?
moment, I will have to. Yeah, sorry.
Is it something serious? So that doctor said me to visit you again.
Okay, okay. At this moment, actually, I will have to examine you thoroughly and do some tests as well. But as long as I've taken history from you, I think that you are suffering from a condition named gout. Have you ever heard of it?
No.
Please don't bother about the term. It's actually a condition in which there are some crystals, okay, can be deposited in some parts of the body, okay. However, we will have to diagnose it first, but there can be some factors behind it. So, like that, your kidney condition is not under so much good control, and also some of your food habit and your smoking. Sometimes this can also add to your problem as well. However, we will have to confirm it at the first, and then we will get to you. But at this moment, we don't think that it might be that much severe. However, it can be controlled by changing some lifestyle medication and also some good lifestyle motivation and also some good medication and follow up. Are you getting me?
Yes, yes, doctor.
Okay. Do you have any more concerns?
Do I need any admission? Time up.
Okay.
You want to examine or want to question?
Yeah, I would like to examine the patient.
Yes.
At the beginning, I would like to expose the patient properly. Then I would like to have a look at his both ankle joints and also uh, the foot and sole to find out any injury mark present or not. And then about the right ankle joint, look having a feel at the temperature, and then also surrounding joints and also of the pulse. Okay, the distal pulse, arteria dorsalis pedis, and then I would like to do knee jerk and plantar, and then I would like to tell him to for, keep his knee straight, and I would just like to palpate, okay, to look for any crepitus present or not in the knee joints, and then I would like to have a look at, tell him to sit down and look for anemia present or not, and then I would like to have a look at his eyes, how about it, and his visual field and just light reflex whether cataract present or not, and then I would like to listen to his chest, okay, and whether about his heartbeat and pulse, and also to his lung. And sorry, and also at that time I would also, at the time of leg examination, I would also like to uh, look for edema, and then I would also like to look for at his hand for any dialysis mark present or not, and also at the tummy, sorry, to look for any renal transplantation mark present or not. And I would like to complete the examination by measuring blood pressure during routine dipstick examination, and urine routine trypsin, and that's all I think.
Okay. So have you reached at any diagnosis?
One minute, please. 1 minute. Are you there?
Yes.
Okay. So at this moment, I have some differentials in my mind. However, my main differential would be would be gout. Okay, which can be secondary to due to some risk factors like smoking, seafood, smoking, then red meat consumption, then chronic kidney disease, which is not under very good control, and also osteoarthritis. Okay, these can be the risk factors, and there can be some other causes behind this manifestation, like septic arthritis, pseudo gout, uh, even osteomyelitis. This can be, I think, the disease here.
Okay. How will you investigate this case?
Okay, first of all, I would like to do some routine blood tests involving complete blood count to see look for any anemia which can be present in chronic kidney disease, and also neutrophilia to look for any infection. And also I would like to look for ESR and CRP to rule out any inflammatory condition. And then I would like to do the renal function test to have a look at his EGFR and serum creatinine and liver function tests. And then I would like to do some ECG, echocardiography, then urine routine microscopic examination, and OGTT, HbA1c, and rapid random blood sugar level. And also, I would like to do I would like to do serum LDH level, and then I would like to do the plain X-ray of right ankle joint, both AP view and lateral view, and if needed, then I might have to also do MRI and MRI of the same ankle joint, and I would also like to do blood culture, okay, and urine culture in this patient, culture and sensitivity in this patient.
Do you like to do joint fluid aspiration?
Yes, I must do joint fluid aspiration to rule out septic arthritis.
Only for septic arthritis or any other?
Sorry. Joint fluid aspiration is a must. For septic arthritis, I might see some haziness, okay, hazy or cloudy joint fluid. And in case of gout, I think I can find some crystals which is on on uh, on detailed imaging, which can be found as negatively birefringent crystals. I think
Okay.
needle shaped negatively birefringent crystals.
How will you manage this case?
Okay. First of all, I will have to educate and counsel the patient. And then I would like to form a multidisciplinary